We're back now with Ariel Reshiv, who is sitting in for us for Eva Pilgrim, and Dr. Darian here this afternoon. It is Breast Cancer Awareness Month, and we are shining a light on the growing number of young women being diagnosed with cancer each year.
Yeah, it is great to be here with all of you and to help launch GMA3's Faces of Breast Cancer series, meeting women around the country, taking control of their health and sharing their personal stories.
And today we're focusing on prevention, and I'm pleased to introduce breast medical oncologist from NYU Langone, Dr. Elizabeth Comen.
Good to see you, Dr. Comen. It's a friend of ours. She's been here before, of course, and now we have gathered some young women from across the country who have questions for you, Dr. Comen. So we'll start with Diana. What do you have, Diana?
Good afternoon. My question is, are breast self-exams still recommended if I get regular mammograms?
Thank you, Diane. That's an excellent question. And I and so many doctors do recommend that women do self-breast exams. How do you do them? There are some great tools online for how to do it, but I recommend that if you are menstruating, that you pick 2 to 3 days after your period when your breasts are less lumpy and often less tender. Start on the outside of your breast and work in circular motions with light, medium, and deeper pressure. And you want to move towards the center of your breast. You want to also look for any, not just feel for any lumps, but look for any skin changes, any new swellings, any distortions in your breast, and any new nipple discharge. You also want to feel under your armpits as well and around your clavicle. And the reason why this is so important is because they're on your body. You should know what your normal breasts feel like, so that if you feel something new and different, you feel empowered to talk to your doctor. We also know that there's a rise of breast cancer in young women, and many of these women are finding their breast cancers themselves.
Wow, and you really know yourself the best. How often should we be getting screened?
So for average risk women, we should start screening at age 40. How do you determine what your risk is? There are some great online tools called the Breast Cancer Risk Assessment Tool. You can talk to your doctor about what is your lifetime risk of breast cancer. If your average risk, start at age 40. But depending on your family history or your personal history, you may need to start earlier than age 40. And you may need to couple it with additional screenings such as breast ultrasound or breast MRI if you have dense breasts.
Great information. Yes. And Sonia, we have a question from you.
Yes, hi. Thanks so much for having me and the opportunity to represent so many women out there with similar questions. Is there any increased risk for perimenopausal women who are struggling with hormonal changes and considering hormone therapies?
What a great question. And it speaks to the fact that we are now finally talking about menopause and perimenopause. And for many of us in medical training, we didn't learn about this at all. And historically, we've really swung the pendulum back and forth between saying every woman should be on hormonal replacement therapy to no woman. When I was in my training, the fear was that it was such a much increased risk of breast cancer. And now we know that in many ways we have been misleading women in terms of the risk of breast cancer with hormone replacement therapy, and that most importantly, it is an individual discussion that each woman should be having with their doctor.
Hannah, you are up. What do you got?
So I have extremely dense breast tissue. I was diagnosed with that a couple of years ago, and I started doing the MRI supplemental imaging in addition to my mammograms last year. Something I'm not clear about, though, is aside from it being more difficult to see on mammography, what increases are there, if any, in getting breast cancer because you have dense tissue? Is there something about the tissue itself?
Yes, so that's an excellent question. Let's just define what dense breasts are for a moment. So a lot of people think that it's something that you can see and feel, and this is really something that's determined by a radiologist on a mammogram. And what makes dense breasts harder to detect cancers on a mammogram, it's that it's the ratio of fibroglandular tissue in the breast to fatty tissue. Fatty tissue is going to appear black on imaging on a mammogram, and breast glandular tissue is going to appear more white. So when you have a mammogram that's compressing your breast, it's looking for the difference between the white and black. Here's the tricky part, is that cancer can also appear white as well. So it can be like looking for a snowflake in a snowstorm. And that's why, as in your instance, we often recommend other types of imaging, such as breast ultrasound and breast MRI.
All right, can you talk about the women who are at greater risk?
Sure. So when we talk about risk, the two biggest risk factors for breast cancer are really being born a woman and age. And so there are things that we are modifiable and not modifiable. You can't change how you were born, you can't change your family history, but knowing that really empowers you to understand when you need to start screening. In terms of other risk factors, we know that there are things that are modifiable, like our diet, like exercise, like alcohol consumption, like tobacco usage. So understanding what are the things we can't change and talking to our doctor about whether that increases our risk, and then also understanding what are the things that are within our control.
That's one of the so important things within our control. And we have Nicole. Nicole, you have a question.
Yes, hi. So besides the age-old advice of eating healthy and exercise, is there any other lifestyle changes I can make to prevent breast cancer?
Yes. So we've kind of given these blanket rules to patients about exercise and diet, but haven't really gotten glandular about it. And that's something that I think we're both really pushing our medical field to be more prescriptive about. So I always recommend with exercise, it's not just cardio, and we have not done a good service to women in terms of strength training. Women are too afraid of getting bulky, but it is essential that we build muscle for not just reducing breast cancer risk, but also decreasing risk for other issues as well, like osteoporosis.
This was so good and informative. Dr.
Good
Comen, thank you very
advice.
much. Yeah, we appreciate it. And also special thanks to Nicole, Sonia, Hannah, and Diana. We thank you as well for joining us. And good luck, guys. Thank you.
Thank you.